Hi, everyone. This is Nicole Jorwic, the Senior Director of Public Policy for the ARC of the United States. Happy to be joining you this week to give another update on what is going on in the face of the COVID-19 pandemic when it comes to people with disabilities. Last week, Congress passed the COVID-19, what's being referred to as Package 3.5. It included two main components. One was to add funding to beef up the Paycheck Protection Program, which are the small business loans that a lot of nonprofit organizations have also been taking up, hopefully as a stopgap until we get additional funds. The second was to provide additional funding for states to increase their testing programs. States and local governments were pushing hard for broader funding for states and cities because of the huge financial stress to state systems and budgets in the face of the pandemic, but this was not included. What was included was simply the additional funding for testing for states. Since last week, another update is around education. The third COVID-19 package, the CARES Act, required the Department of Education Secretary to deliver a waiver report to Congress about laws that impact people with disabilities, including the Individuals with Disabilities Education Act, or IDEA. The Education Secretary submitted her report earlier this week and did not recommend to Congress any waivers, the core components of IDEA. Those core components are the requirements that students who are eligible for special education services receive a free and appropriate public education, sometimes referred to as a FAPE, in the least restrictive environment, or the LRE. These were the waivers. There were some waivers. So those are the main components of IDEA. There were some waivers of what are considered procedural requirements, things like making sure that families can sign for IEPs virtually, those sort of things, but nothing to those core components. And so we were really glad to see that. Obviously, the COVID-19 pandemic has greatly impacted all students, and we will continue to push to ensure funding to support students, states, and school districts to have funding that they need to support students with disabilities during the pandemic and also after the pandemic. The focus has now turned to Package 4, and unfortunately, we have a little bit longer to wait for that legislation to see even draft legislation of Package 4. Originally, as I mentioned last week, the Senate and the House were planning to come back next Monday, May 4th. However, because Washington, D.C. is currently considered a COVID-19 hotspot, the congressional physician advised against it. The House has indicated that they will not be back next week. We're not sure when they will. However, at this point, the Senate is still scheduled to come back. But because we are still anticipating that the House of Representatives will hold the pen, meaning they're the ones that are going to be drafting the first Package 4 and also voting on the package first, we are unfortunately anticipating a bit of a delay, but still hoping for mid to late May action. But frankly, there's still some murkiness, and we're going to hopefully know more. A lot of it will depend on what the situation locally in DC is looking like. Frankly, I was very frustrated when I heard the news, because I'm hearing obviously from people with disabilities, from families, the workforce, and service providers about the horrible situation on the ground when it comes to serving individuals with disabilities in their homes and communities, access to personal protective equipment. So I was really frustrated, but honestly, there's no time for frustration because of the direness of the situation that's causing it. What this means is that we have more time to work on additional fixes from the previous packages, and also to get the things that we know that we need in the community into the next package. One important way to do that is to continue to share stories. I've spoken about the #WeAreEssential campaign, and that will continue. We'll be updating to add additional weeks to focus on home and community-based services. But the ARC also this week released a new story collection tool that you can get from the ARC of Arizona. It's right now only our chapters have the link, so our executive directors from the state chapters can send those to you. But it's a story collection tool, and it's really kind of like a Mad Lib, where you can fill in your information and choose one of the major asks for Package 4. So just as a reminder, the major asks for the disability community remain the Home and Community-Based Service, Medicaid Home and Community-Based Services, or HCBS grant program, Personal Protective Equipment, or PPE, for the direct support professional workforce, expanding the caregiver definition included in paid leave provisions to include siblings or grandparents taking care of individuals with disabilities or supporting individuals with disabilities, and also making sure that all dependents are, all adults with disabilities or children with disabilities are included in the stimulus payments. So those are the 4 choices. And so the story collection, you go through, your enter information, you choose one of those 4 areas. For me, I would choose the Home and Community-Based Services grant program, and then you can write why that issue matters to you. And I would write about how my brother relies on home and community-based services to have access to the community, to live in home with my parents, and if he didn't have that he very well could be at risk of institutionalization. And then that will turn into an email that goes to my legislator. And then also that story is something that is shared with the ARC, and that's something that we can use as we're also talking to Congress. And so we really hope that folks are going to take that opportunity to share your personal stories with legislators in a very direct way. And so that's one way that we can continue to, again, push for our 4 main asks: the Medicaid HCBS grant program, the PPE for the workforce, broadening the definition of caregivers, and including dependents with disabilities in stimulus payments. That will continue to be what we push, as well as a lot of additional issues. Please make sure that you're continuing to interact with your state legislators, your federal legislators, and making sure that they understand the very specific and unique needs of the disability community, and remind them that #WeAreEssential. Thank you.